Hi everyone, we'll be discussing the osteology of vertebrae today. So our vertebral column, it has 7 cervical vertebrae, 12 thoracic, 5 lumbar, and it has 1 sacrum and 1 coccyx. Now when you look at the vertebrae, it's really easy to identify sacrum because it's so huge, right? And it's weirdly shaped, so we can easily identify it. But the main confusion arises between cervical, thoracic, and lumbar. So let me tell you one thing. First of all, the common features of the vertebrae. What are the common features that are there in every vertebra? So every vertebra has the spinous process which points backwards. And ensure that you know the processes they are situated on the posterior end of the body. So this is the back side of the body, right? And this person is facing towards this side. I hope you can understand. So this is the vertebral column. This person will be standing facing towards that side because these processes are at the back and this is the front region, right? So I'm sure I've cleared this. Now you can see these are the vertebrae, and between the vertebrae there is a vertebral disc or intervertebral disc. These are the transverse processes, and this is a spinous process which points directly backwards. So there's some key features in every vertebrae that are common. Spinous process, then the transverse process, they point towards the sides. Then you have a vertebral body, you have a vertebral foramen, and then you have superior articular facet and process, superior articular facet and process, and then you have inferior articular facet and process that I cannot see for now in this diagrams, but they're there because this is the superior view. And yeah, that's pretty much it. But there's some unique features as well in all of these vertebrae. Let's discuss those for now. And one more thing, cervical vertebrae, as I've told you, there's 7 of them, right? So in the beginning, the first, second, atlas, and axis, right? And the first few ones, they are really small in size compared to the sixth and seventh one. They're huge. Why? Because they start off small, so that like in the starting, the vertebrae are small, so that they can be more mobile, and the lower ones are bigger to handle the weight of the head and the neck, right? Now, this is the cervical, this is thoracic, and lumbar. You can see it's so huge and chunky. Now, the main confusion arises between cervical, thoracic, and lumbar, right? As I've already mentioned. When you talk about their spinous process, now this is a very, very key feature. So you'll notice that the spinous process of the cervical and the thoracic, they point posterior-inferiorly. They point posteriorly and also inferiorly. So if they're pointing posteriorly, they're also inferior, posterior-inferiorly. Whereas if you talk about the thoracic vertebrae, its spinous process, it points directly backwards, like straight backwards. It's completely straight and at the back, unlike the cervical and thoracic, right? So this is one key feature. Here also you can see this is cervical, thoracic, and lumbar. So lumbar spinous process, as I've told you, it's straight towards the back. But if you look at thoracic, it's posterior inferior, and even cervical is posterior inferior. So that's the first key feature. So this is how you can differentiate between the lumbar and the cervical and thoracic. But how would you differentiate between these two, cervical and thoracic, between these two? How would you differentiate between the two? That's very easy. Why? Because cervical vertebrae, they have something that none other has, which is this foramen right here, which is known as foramen transversarium or transverse foramen. So that's a Latin name, transverse foramen. This is there only in the um, cervical vertebrae. Other than that, you won't find this foramen in the transverse process anywhere. So it's so easy to differentiate between these two, right? So once again, what did I say? That for lumbar, the spinous process, it points directly backwards, straight towards the posterior end. And for these two, it's posterior inferiorly. And how will you differentiate between these two? That this has a transverse process. So what are the other, distinguishing features between these two if you get confused? So what are the other features? The other features are that the lumbar process, right? The lumbar vertebrae, right? It's superior articular process, or you can say it's superior articular facet. It has a mammillary process, very important. So this is the lumbar vertebrae. This is the vertebral body. This is the transverse process, this is the spinous process, this is the superior articular process and facet, and then similarly inferior articular process and facet. So its superior articular process, it has a mammillary process. Here also you can see mammillary process. This is only found in the lumbar vertebrae, in the superior articular process of lumbar vertebrae. Whereas you won't find this in the thoracic vertebrae. So what can you find in the thoracic vertebrae? In thoracic vertebrae, and it's now this is a third distinguishing feature. In its transverse process, this is a transverse process, and in its body, you will find coastal facets. Coastal facets are basically the regions where the coastal cartilages or the ribs they're going to basically articulate. So in the body, it has two coastal facets. This is the superior coastal facet, inferior coastal facet, superior coastal facet, inferior coastal facet. So body will have two of them, and the transverse process, it will have a transverse coastal facet. See, transverse coastal facet. So here also the basically coastal cartilage they're going to articulate, and you can see the spinous process. It's pointing posterior and inferior, right? So this is the thoracic vertebrae. Now, I mentioned all the key features and everything. There is one very important feature that I also skipped here. That is the lamina and pedicle. Students often get very confused between the two. So here, I told you this is the vertebral foramen, right? Now, a vertebral foramen is there, but this region right here, it's the vertebral arch. Now, vertebral arch, it's formed by lamina and pedicle. Now, where exactly is lamina and where exactly is pedicle? So, towards the posterior side, we find the lamina. So, yeah, this is lamina. And the one that's closer to the vertebral body, that's the pedicle. Now, I hope you won't get confused. It's so nicely highlighted here. So please don't get confused. Lamina is towards the posterior side. Pedicle is here. Lamina of the vertebrae is one of the two. Let's highlight it. Lamina of the vertebrae is one of the two large flat bony plates that form the posterior part of the vertebral arch, which encloses the spinal cord. Then you have pedicles. They serve as crucial connectors, bridging the vertebral body with the lamina and the transverse process. So basically, they're saying that the pedicle they serve as connectors, bridging the vertebral body with the lamina and the transverse process. So basically, that's the function of pedicle. It bridges this and this. Then you have lamina and pedicles. They form the vertebral arch, which encloses the spinal cord and the nerve. As I've told you, lamina and pedicle, they form the vertebral arch. And what does this enclose? Spinal cord and nerve. So, well, this has answered one of the questions I was going to ask towards the end. Um, like these are the FAQs, which are very frequently asked questions. One of which was, what is the content of the vertebral foramen? It is the spinal cord and the associated nerves. And another question is, what are the contents of the transverse foramen of the cervical vertebrae? Where is transverse foramen? Only in the cervical vertebrae. So even if they don't clarify that we're talking about cervical vertebrae, you should be knowing. So what are the contents of this? Vertebral artery, vertebral vein, and sympathetic trunk, right? So these are the contents. Now, one more thing is there to just differentiate between cervical vertebrae and the rest. So cervical vertebrae's vertebral foramen, it's triangular in shape. For rest, they're circular or oval or whatsoever, right? And also one thing they said that the thoracic vertebrae is heart shaped. So thoracic, and here I was talking about the cervical, that its vertebral foramen is triangular in shape. For the rest, it's circular. Now, another thing here is that cervical vertebrae. Let's focus on cervical vertebrae, atypical and typical. So you have atypical and typical. These are the two categories. Atypical are 1, 2, and 7. Typical vertebrae are 3, 4, 5, 6. So this is very important. Keep in your mind, just memorize this for now and forever. So yeah, this says that C1 and C2 and C7, they have slightly different features compared to the rest. Now C1 is known as Atlas, C2 is known as Axis. C1 is known as Atlas, C2 is known as Axis. So if you talk about Atlas and Axis, how can you differentiate between the two? Now, Atlas is so different because it has no vertebral body. It has no body at all. Whereas Axis, it has an odontoid process. Odontoid process is also known as dense process. So this is one feature that none of the other vertebral like vertebrae has. right? So that's how you can differentiate between the two, C1 and C2. So yeah, that's pretty much it. And I hope I've cleared the basics. Let's quickly review this table. 7 cervical, 12 thoracic, 5 lumbar. Cervical is found in neck, thoracic in chest, lumbar in the inferior portion of the back. Cervical vertebrae are small, oval, and they have curved faces. So these faces are curved, you can see. Thoracic vertebrae are found in the chest. They're medium, heart-shaped, flat faces. So their faces are flat, and it has facets for rib articulation, the costal facets. And lumbar vertebrae, as I've already told you, they're massive, chunky, they're oval, and they also have flat faces. So flat faces, and curved faces. Now vertebral foramen for cervical is large. For this, it's medium. For this, it's small. Now, spinous process is split. It's also known as spinous bifid. It means it's it's split. And if you talk about its position, so it points posterior inferiorly. This also points posterior inferiorly. This just points posteriorly. And its a spinous process is long, slender, and it's not split. It's blunt and broad. Now, a transverse process, this has a transverse foramina. This has no transverse foramina, but it does have facets for ribs. So it has transverse costal facets. And for this is so unproblematic. Its transverse processes are present, they're short, and there are no articular facets, there are no transverse phenomena. And these are the functions, you can read them. So I hope everything is clear for now.